Hello, dear friends. This is Dr. Jambukeswaran, PrepLadder's orthopedic faculty for you. So, am I clearly visible and audible? If somebody is watching, just give me a thumbs up sign so that I can see in the live chat. Show me a thumbs up sign. Am I audible? Hello? Yes, crick fun. Yes. Okay, so we'll go ahead. So we are going to just do a recall session of INI-CET November 24, the exam which happened yesterday. Okay, so I was able to spot out hardly 5 to 6 questions from orthopedics. Most of them are yes. Okay, Anmol Pankat, Rook. Thank you. So we'll straight away go to the first question. A 35-year-old patient presents with complaints of back pain, stiffness, and recurrent episode of eye pain with redness. On examination, they are found to have anterior uveitis and sacroiliitis. So directly they are asking, the diagnosis is ankylosing spondylitis. The diagnosis is ankylosing spondylitis. Which HLA is involved? It's a very straightforward question. Which HLA is involved? You want to answer? Probably you know the answer. Anybody? Anybody? Hello? Bhaskar Singh is there. Yes. Yeah. Mridul has answered this as HLA-B27. That's the right answer. This should be the answer. Okay. Because straight away they are asking the question ankylosing spondylitis. There is no doubt it is HLA-B27. DR4 it's there, it's in rheumatoid arthritis. DQB1 it's a different condition. Okay. Yes. We will move on to the second question. A 45-year-old female met with an accident, brought to the trauma center with X-ray pelvis performed. The image shown below shows an intracapsular fracture neck of femur. What is the best management? That's the question. Okay, a similar image, everything is there in our app. See, you have to assess two things. Okay, it's intracapsular fracture neck of femur. The main thing to plan for the management, one depends upon Gordon's classification, another depends upon age of the individual. The age of the individual is 45. They have given 4 options: closed reduction, hemiarthroplasty, open and closed reduction, open reduction, internal fixation. 4 options are there. Okay, so 45 years, that's a very important thing. 45 years is not that old, so we have to go for a procedure which conserves the head. Doing a joint replacement is very easy, but the age is 45. If it is 60 years, if the age is 60 years, there is no doubt the answer should be hemiarthroplasty. Since it's 45, I will go for open reduction internal fixation. That is called, see, what you have to do is, you can do it under C-arm, you can do a closed reduction also, or even when you open it, you reduce it, fix it with 3 screws like this, and the screws should be in the form of inverted triangle. Okay, 1 screw here, another screw here, another screw here. When you see in that section lateral view, it should show an inverted triangle like thing. This is called 3-point fixation. This is called 3-point fixation. It is there in our main recording. When you see exactly age-wise treatment plan is there. So I feel this should be the best answer. How many of you have answered reduction, open reduction and internal fixation? Anybody, can you please respond? How many of you have answered this? Yes? Hello? Yes, sir. Neville Mendes have answered that. Good. So this should be the right answer. We will move on to the next question. We all to the next question. Okay. And Mridul Saini also have answered it correctly. Excellent. Fracture after a trivial fall. This is the word in an elderly patient. So somebody had developed a fracture. So here it shows a fracture line, some pathological lesion here. Somewhat an X-ray like this was given in your exam, right? Probably they said that, students said that here some erosions were there here. So what could be the probable diagnosis? In an elderly patient, trivial fall, fracture is happening. That should be a pathological fracture. That should be a pathological fracture. So the choice is given. Tuberculosis of the hip usually won't cause pathological fracture. It undergoes stage of synovitis, stage of early arthritis, late arthritis, and stage of pathological dislocation. That's called Babulkar and Pandey. Already we have discussed that. Brown tumor, hyperparathyroidism, very rare. Eosinophilic granuloma happens in children. Eosinophilic granuloma, that's histiocytosis X, usually not in the age. So it should be bony metastasis. I personally, so a metastasis, and see metastasis, you may, one doubt may come to you, dear friends. Can metastasis happens in shaft of the femur? Okay. Can metastasis happens in acetabulum of one side was not visible clearly? Yes. Ramya ji, yes sir. Okay. So you may be in doubt that, sir, can metastasis happens in diaphysis of the femur? Yes, metastasis can happen. Where metastasis is rare? Below elbow and below knee metastasis is rare. Metastasis is common above elbow, above knee. So thigh is above knee. So metastasis is very much possible, and I personally feel bony metastasis should be the right answer. Okay, we will move on to the next question. Difficulty in standing on one side of the hip is due to problem of which of the support of the other supporting muscle. So what he is asking, he is indirectly asking if Trendelenburg test is positive. Okay, Trendelenburg test positive. Which muscle is affected? It should be the powerful hip abductor, and that should be gluteus medius. This should be the right answer. That should be gluteus medius. I don't know whether this is in anatomy session or ortho, but something related with our ortho, so I am including this. So this is gluteus medius. Okay, yes. So most of you would have answered this correctly. Can you give me somebody respond, please? I think most of you would have answered this correctly. Gluteus medius. Hello, anybody, please? The last question Ramya has answered. Ramya ji has answered. So anybody here? Yes, sir. Yes, sir. So Mridul Saini. Okay, excellent, man. Good. Okay, so you'll move on to the next thing. We will move on to the next thing. Yes, then, yeah. In pin palsy, posterior interosseous nerve palsy, in posterior interosseous nerve palsy, which will be there? Definitely wrist drop cannot be there because that is direct radial nerve. Radial nerve injury, whether very high, there will be wrist drop. So it is not wrist drop, that is direct radial nerve. Extension of elbow is not affected, that is wrong. That again in high radial nerve palsy. Extension of finger should be the right answer. Supination of forearm is not there. So extension of finger. So pin palsy causes finger drop and thumb drop. Finger drop, thumb drop. Wrist extension will be possible in pin palsy. So pin palsy, which will be there, extension of finger, which will be there. So it is which will be affected. Okay, which will be affected. Which will be affected? Extension of fingers will be affected. Extension of fingers will be affected. Wrist drop won't be there. Extension of elbow is not affected. Supination is not affected. Extension of finger and extension of thumb are affected. Okay. So, Shri, sir, intracapsular fracture isn't it closed reduction plus internal fixation? Yeah, if closed, see, yeah, Ramya ji have answered this question correctly. So, Sirisha Siri, if the choice is closed reduction and internal fixation, that should be the right answer. That's what I am telling. 3-point fixation under C-arm control, fluoroscopy control, no need to open in all cases. I used to do by closed, daily, routinely we are doing it in our hospital, only closed reduction, internal fixation. Okay, so what's the choice? Dear friends, we will clarify this now itself. Was the choice for this question is open reduction or closed reduction? Yes, sir. That option was there. Sirsha Sri has said that instead of open reduction, close reduction plus internal fixation. This one choice was there. She is telling if close reduction, internal fixation is there, this should be the best answer. This should be the best answer. Okay. So yeah. So if close reduction, internal fixation is there, that should be the best answer. Okay. So clarified. Good. Good. Okay. Close reduction, internal fixation was Anand. Thus, Anand Dasari has answered close reduction is there. If close reduction, internal fixation is there, that is the best answer. There is no doubt. Yes, good. Okay, so we will move on to, so this is Trendelenburg gluteus medius and this is pin palsy. Last question, FRAX. They had asked about what is the expansion for FRAX. It is fracture risk assessment tool. Okay, fracture risk assessment tool. Where we will do this fracture risk assessment tool in osteoporotic individuals. In osteoporotic individuals, we will assess what is the chance of fracture. To prevent that, we will introduce some medication. So FRAX is fracture risk assessment tool used to assess the fracture risk in osteoporotic individuals. That's all. Okay, so we have completed the 6 questions. I think most of you, Aditya Sharma, sir, can you tell about the difference between wandering acetabulum and METS? I think it was there. Okay, so he is telling, since Aditya Sharma is asking a doubt, suppose he is expecting, since there was erosion in the acetabulum, he is suspecting wandering acetabulum. Yes, dear Aditya, it's a possibility, but what I am telling, clearly many students said that, and a few of my students said that it showed a typical pathological fracture in the shaft of the femur. When pathological fracture is there in shaft of the femur, it is not due to tuberculosis. That can be because of metastasis, because the word that is used is elderly individual. Fracture following a trivial fall. Fracture following a trivial fall. Okay, so this has followed after a fall. So already the bone is somewhat damaged, either by osteoporosis or by metastasis. So only pathological fracture, usually these are the causes in elderly, no? So since metastasis is there, more chance for that only. Wandering acetabulum, if there is no associated fracture, you are seeing 2 acetabulums, that can be a case of wandering acetabulum, that is stage 4, Babulkar and Pandey stage 4 tuberculosis of the hip. Okay, yes. Thank you. Okay, sir, thank you. Thank you, Aditya Sharma. I think all the best for you guys. Okay, thank you so much. I'll wait for 2 or 3 seconds. If any doubt, you can chat with me. Osteomyelitis 2 and Advait Pillai. Thank you, sir. Advait. Okay. So Advait, how are you, da? Huh? Okay. So good. Right? All the best, guys. Thank you so much.